Hello everyone, my name is Adam Ibrahim. I'm going to present advanced in wearable and portable based biomarker of epilepsy diagnosis. My presentation outline is introduction. Under introduction, it is brain disorder, electroencephalograph, history of EEG, and also I'll try to address the medical design of EEG, principle of EEG, usage of brain tests, commercial availability, limitation, and this is summary. New statement of the biomedical device of EEG, the way to treat seizures frequency and severity in patients with epilepsy, with reducing rate of acute neurological complication by 20 within 12 months. Introduction. As you know, our brain is a complex organ. It's developed with about 100 billion neuron cells. We call it neurons. These mental diseases are disorders that affect our cognition, emotion, and behaviors. According to World Research Organization, globally, 1 billion people is easily affected mental disease. 50 million people is affected by epilepsy, and 24 million is affected by its dementia. Electroencephalograph, that is one of the part of medical device. It is used to measure or record electrical activity in the brain. In brain, it has electrical activity. It is arise from neuronal communication, where neurons communicate each other to generate electrical impulses. During these, the brain needs electrodes. Electrodes are tiny, it's the metal disc that serves sensors that are placed on the scalp. In the figure, this EEG is how to EEG is where in our head. Those EEG has at least 10 up to 20 electrodes around the scalp. Those electrodes are connected with a tiny wire, and that leads to amplifier. After amplification, it generates some sort of waves. That's how to generate data in the computer. Our brain depends on electrochemical activity within nerve cells. It is generate electrical signal. This electrical signal is depending on depolarization and repolarization in the neuronal cells, which is driven by its calcium and sodium and potassium ions. Those ions generate electrical potential from signal transmission at synapses. Abnormal brain activity, which changes the function and activity of the human body parts, organs, or appears the unusual brain electrical activity. When it comes to the history of EEG, in the first EEG is introduced, this type of EEG is in 1975. This type of EEG, we call it galvanomotors. In 1924, the first EEG is the birth of human EEG, and in 1930s up to 50s, it is some part of the previous one. It is some part of its modification. It serves as clinical development, especially for epilepsy diagnosis. In 1950 up to 70s, this type of device, the type of EEG device is better to it is highly advanced than the previous one. It is standardized, and it also has 10 auto-electrode systems. In 1980s up to 1990s, this EEG is very advanced. It has digital and working with computer based. In 2010s, this type of EEG is very portable, easily handled, and also we call it is ambulatory EEG. Nowadays, these EEG devices is easily wearable, and also it is portable for users. These smart wearable EEG has AI integrated, and it has Wi-Fi and Bluetooth used. How to develop and design is wearable and portable EEG. These EEG should have electrodes. These electrodes are contain silver and coated with silver chloride, and also has 10 auto electrode placement system. And after electrodes, it needs to design amplifier. This amplifier has high input impedance, low noise, and has high SMRR. The data is almost greater than 100. After amplifier, it is the design the filtering system. The filter system it must contain 0.3 up to 70 hertz, and sampling, and finally check the safety and validation. Let's come back to clinical EEG. The principle of EEG, how working of the EEG, is working with electrodes. As mentioned earlier, these electrodes are connected a single wire to detect voltage fluctuation or electrical potential differences resulting from flow of ionic current inside neurons. These electrodes is connected a single metallic wire that is amplify and finally generate some sort of signal. This electrode positioning is a SCAL basic 10 out to 10 international system. Look at the figure how the electrodes are put in our head. Those electrons has 10 out of 20 positioning. Scalp electrons and going to an instrumental amplifier. After amplification, active high pass filter and active follow-off pass filter and notch filter. The notch filter is remove unwanted signals or artifacts, and then it needs post amplifier adder, finally add DAC card, and the data is generated in computer storage display. The data can extract using this computer. EEG records brain electrical activity using scalp electrodes. Epilepsy, as you know, especially for EEG, is a major electrical activity, especially those epilepsy patients. Epilepsy is a type of disease. It's a neurological disorder, which is it has own characteristics. It's recurrent unprovoked seizures. And also EEG help to detect abnormal brain activity besides of epilepsy, identify seizures type and origin, support diagnosis and treatment planning. Usage of EEG is also mentioned in earlier. Diagnosing of role of EEG detect epileptiform discharges. These epileptiform discharges could be spikes, sharp waves, spiked and wave complexes. Localized seizures focus. It is focus the
target of seizures to identify the brain region where seizures are start, and classification seizures. It can be classified focal and generalized, and also it also differentiates epilepsy from other conditions like from fainting, psychological seizures. This the diagram. This is our brain. These are the system of how electrodes are put in our brain using different systems. One of the electrodes are using the frontal system, parental system, occipital or occipital system, temporal system, etc. system. These mostly even numbers are at the right side, or numbers are at the left side, and at the middle one using the number of electrons put. Those even numbers at the right side, the electrons those are odds at the left side, and the rest are possible in there. Key difference points like lesion above the noise anywhere in the back. A1 and A2, it is especially electrons for error reference points. What are normal EEG waves? How to differentiate EEG waves from normal one to pathological one? Look at the picture. This normal one just look like this one. It is very keep maintain the stable wave, but in abnormal one, it could have some fluctuation of waves. Just look like that's easily identified one. This normal one to abnormal one. For example, normal versus abnormal brain images. This one is normal, this is abnormal. Partial seizures for this abnormal one. It is look, this some signals, some waves are generated at specific region. It can easily identified by this normal one. Type of EEG device generation. The first generation, mostly it is analog. It is large stationary and paper-based, and the second generation is somewhat is improved from the previous one. It is digital signal conversion, improved by its accuracy and more compact. The third generation is portable. It's used more. It's small and battery powered, and also we can use in our home real-time image monitoring. And the fourth generation is very advanced and using AI for analysis of different brain disorders. The fifth generation is very advanced EEG biomedical device, and it uses Wi-Fi and Bluetooth. This commercial availability of EEG device, these are the listed of the device here. It is commercial availability, especially in the market. It is smart, it is easily handled, it is portable. We can manage our service. It is brand names in NeuroSky, Neuro, Index, Plex, and Advanced Brain. It can easily design, easily manage in our use in our home without requiring any help of physicians. This type of devices, especially for epilepsy patients. This is how to diagnose different brain disorders. It also since different brands, different type of EEG devices. This brand name Model Nation 7128 watt. These devices easily we get in the market.
Okay, advantage of EEG. One of the advantage of EEG, it enhances comfort. Patients feel comfort when wearing EEG system. It allows natural movement, reset periods during monitoring, and also it has high convenience. Device such as, for example, the Zito EEG, it is handset features, rapid give a response within 5 minutes setup without using gels, pastes, improving workflow and patient experience. High adherence, it has high adherence, simple and user-friendly, ample literacy design, promote stroke patient compliance. The limitation of EEG devices, one of the limitation is low spatial resolution. It is because it cannot accurately locate, and especially in deep brain tests, noise sensitive, prone to artifacts from eye blankets, movements, and electrical interferences. It is easily affected by artifacts, and shallow detection mainly capture surfaces, cortical activities, not in deeply analyzing. Need expert analysis. It is need highly skilled trained persons, and the data is vary from individual variabilities, because the results vary across users, limiting generalization. Conclusion, EEG device is a valuable non-invasive tool for diagnostic various neurological disorders by recording electrical activity in the brain. It's especially effective to detect conditions like epilepsy, sleep disorders, and encephalopathies, other related brain disorders. And also it has some limitations, special resolution, especially in real-time monitoring, regarding safety, cost effectiveness, makes an essential component in neurological diagnosis. Thank you for watching this video. Help you understand wearable EEG technology is a little better, and share and like and subscribe of this video. Thank you very much.